The proposed health care tax could hurt the people President Obama vowed to protect the most, the middle class. One doctor who says his patients will be the hardest hit is here to explain.
The latest suggestion by the Obama administration to pay for this massive health care reform could land plastic surgeons now on the unemployment lines.
We've talked about regular doctors and surgeons, but not about plastic surgeons, because a proposed 10% tax on plastic surgery procedures could negatively impact the middle class, who have, of course, voted for President Obama and the president has vowed to protect.
Facial plastic surgeon Dr. Mark Clymer joins us now live from Nashville to explain. Okay, so Dr. Clymer, you are a plastic surgeon, and you say that when you impose this 10% tax on procedures that people come to your office to receive, that in fact could lead to very dangerous options for people. How?
Well, I think any time that people are placing cost above quality, and if there's an imposed tax that's going to raise costs, people will be driven to seek out some alternative treatment measures. And those alternative treatment measures could be offered by people who either don't have the same background, training, expertise as other surgeons in the field, or they could be offered in an environment that's not as safe or protected as, for example, an outpatient surgery center. So we could move some things into more of an office-based setting.
And one of the things that, Democrats have tried very effectively, they have tried, I should say, to say, look, it's not going to cost the middle class anything extra. However, when you look at this, some of the biggest consumers of plastic surgery are the middle class. So if you are whacked with a 10% tax, obviously you're going to have to pass that on to the middle class who uses your services.
Right. The surtax is actually on the procedure itself, so the patient will end up paying for that. And the patient's, one of the gross misconceptions about cosmetic surgery is that it's something that's only done by the rich and famous, which in fact is not true. Some statistics have shown upwards of 90% of people who have cosmetic surgery procedures have a household income of $90,000 or less. So depending on whatever definition of the middle class you use, it will be a tax that's levied on the middle class because they are the consumers of cosmetic surgery primarily.
Right, and 86% are women, so it could be viewed as targeting women as well. We should mention that in New Jersey, they tried this in 2004. It was unsuccessful in bringing in the revenue they expected because people went to Pennsylvania and New York to get away from the tax. Very interesting perceptions from you this morning. Dr. Mark Clymer, the plastic surgeon down in Nashville, thanks for being our guest.
Thank you. Appreciate it.
Okay, straight ahead.